The largest affected age group remains individuals aged 20 to 29 years of age, accounting for 22.9% of our local cases. 5.3% of our county's COVID-19 tests have been positive, compared with 11% for the state and 6.3% nationally. In terms of hospitalizations and intensive care units and ventilator usage, there are currently 10 patients with COVID-19 in our local hospitals. 4 of them are in the intensive care units and 1 on a ventilator. Our local emergency department visits for respiratory illnesses did increase a little bit from 150 during the week of May 31st to 197 during the week of June 7th. And our final data point that we've been monitoring is the number of deaths due to COVID-19 in Tippecanoe County. Unfortunately, we have had another death in Tippecanoe County due to COVID-19, bringing our total to 6 deaths. This individual was over the age of 65 and had other medical conditions. So much of our county's data is showing a favorable trend. However, it is important to remember that new cases of COVID-19 are still occurring, and that we could see an increase in cases as reopening expands in our community and state. So it is critical that we as a community remain steadfast and vigilant in our approach to this pandemic. We want to act wisely and responsibly because all of us play a vital role in preventing COVID-19 in our community. Recently, as many of you are aware, there have been large increases in cases in Florida, Texas, and Arizona. What's happening in those states is an unfortunate reminder of just how easily this virus can spread and how things can easily take a turn for the worse with COVID-19. So we want to do everything we can here locally to prevent ourselves from following that same trend. That concludes all the remarks that I had for today. I'd like to open the floor to any questions from the media or from our Facebook Live audience.
So a lot of those states are now, I have to walk up there. Sorry.
If you don't mind.
This is your first interview?
It's my first interview. So my question is in regards to Florida, Texas, and Arizona. A lot of those states are now, not forcing, I guess that's not the right word, but telling people that they are required to wear face masks. If we do see any type of a large increase similar to that, is that something that you guys would consider?
Well, we are watching all of the data very closely in our county, and certainly if the data takes an unfavorable turn, we would have to consider various measures to help prevent further transmission of the virus. Currently, we're following the CDC and Indiana State Department of Health guidance, which recommends face coverings in public settings where social distancing is difficult to maintain.
Question from Emily Seiberg from WBAA. How will the health department be using the zip code level case data now being provided by the State Department of Health?
That's an excellent question. That data is particularly useful if there is a cluster of cases where you see a very disproportionately large group of cases in one area versus another. In general, we can say that COVID-19 seems to not be just present in certain zip codes. It can happen anywhere. So we don't want people to look at that data and think that if they don't live in that zip code that they are necessarily not susceptible to COVID-19. So it's important to keep in mind that this infection can happen anywhere, but that information can be useful for identifying large clusters of cases.
Question from Facebook Live. Have you considered adding a representative from Purdue so we know what is happening on campus?
We have not considered that for this meeting. However, the health department does interact with Purdue and with the task force at Purdue that is working on reopening the campus. So I could certainly request or ask them if one of their representatives would be willing to come and speak here.
And to add to that, we are in constant communication, obviously. We are getting a lot of concern on the part of our citizenry as to how we're going to handle 45,000 students between the ages of 18 and 26, how that's going to impact our numbers that are obviously going in the right direction, what steps are being taken by Purdue and what steps are being taken by the city. And right now, it is just an ongoing conversation, an ongoing dialogue. And as soon as that event occurs, we'll be monitoring not just numbers, but also behavior. You know, we have, the really neat thing is that if you drive around West Lafayette, you go into the stores in West Lafayette, it is rare to see somebody who is not wearing a mask. So the process, the understanding how critically important it is to wear a mask is coming through and is showing that, it's proven that people are aware and listening. The other issue is that we oftentimes get asked, me specifically, and I presume Tony and Tracy probably get the same concerns, what are we going to do to prevent people from infecting us? And there has to be a give and take with that. There has to be an understanding that there is only so much that we can do. But it's imperative that people understand they sometimes have to take control of their own destiny. They have to take care of themselves. They have to wear a mask. They have to keep the social distancing. They have to wash their hands. I mean, the mantra has not changed. So, granted, we're going to have a lot of people in that experimental age bracket, but that doesn't mean that we should let our guard down. We still need to go out every day with the understanding that the virus is active and very communicable.
Thank you.
He told me to say all that, so.
It's me again. I have a question in regards to Rosewalk Village. Do you guys have any updates on that? That was the first cluster that was identified here in Tippecanoe County. We had a couple of people emailing us saying that when you guys released that information to the media, that people who had loved ones at that facility had not been made aware of that until we told them about it. What would your response be to that?
Okay. So the cluster of cases at Rosewalk Village, I do have an update. They currently have 23 residents who've tested positive for COVID-19 and 9 employees. Importantly, they've had no new confirmed cases in the last 72 hours. In regards to the facility informing the families and the public, Rosewalk Village had posted their case data on the website, on their own website, prior to us announcing their cluster here. So that information was made available by Rosewalk to the general public.
Jordan Smith with the Purdue Exponent. I'm just wondering if you've been in touch with Purdue Athletics as football players returned last week and were tested. Basketball players returned this week and are being tested. How are they communicating who, if anybody, tests positive?
Okay. I have not had any contact with the athletic department at Purdue. Anybody who tests positive, those results would be reported to the State Department of Health and then ultimately to us too, so we would be aware of positive test results occurring on the Purdue University campus.
Question from Dave Banger. Have you reviewed the Protect Purdue Plan released on Friday? What is your take on it, and is Purdue lined up for a safe opening for the fall semester?
I have read the Protect Purdue Plan. I think it's a good plan. It's well thought out. It does a good job of laying down processes to protect students and faculty and staff on campus, in classrooms, in laboratories, at dormitories, and in dining halls on campus buildings. Of course, the one factor that can't be controlled completely is the behavior of students and other Purdue personnel outside of those campus buildings, off campus. And that's the X factor. That's the human factor in this. And that's the part of the Purdue Plan that we have to have faith that the Protect Purdue pledge will be taken seriously, and that everyone at Purdue, students and staff alike, will take that pledge seriously and continue with those behaviors and processes to protect the community even when they're off campus.
Dr. Adler, if I could
Yes.
add to that just for a moment, please, and add to what Mayor Dennis said earlier. Purdue has stayed in contact with the city of Lafayette as they've been putting this plan together and been giving us good updates in regards to what they're doing at Purdue and obviously around West Lafayette, which is most centrally connected. But they have reached out in the past week, and I've got a few calls from citizens wondering about this. They have reached out in the last week and from their task force and said, hey, we've really worked on campus and West Lafayette, and they've worked on that piece of the plan, and they actually reached out to me and said that they would like City of Lafayette to put together an executive team to meet with them now to discuss how they can help keep Lafayette safe and how we can partner to ensure that the people that are leaving off campus, to the best of our ability, as Dr. Adler said, and what else can they do looking at the city of Lafayette. So I don't remember the exact date of the meeting, but we do have that. We're getting that scheduled if we not. So those discussions are taking place also directly with the city of Lafayette, because they know we do have students that come over and live on the Lafayette side, and getting ready to tackle that piece. So I want the community to know that those discussions are taking place. Look at how what happens at Purdue we know can affect both cities and the county, and what we can do together to help minimize that. So there really is good communication and a very thorough process being looked at.
Question from Facebook Live. Moving forward to July, August, September, and October, how will local events be impacted? As, for example, the Wabash River Ride in August has been canceled. More specifically, will fall events be canceled or limited in attendance numbers?
You know, it's very difficult to predict at this point because we don't know what direction this pandemic will be going in at that point. More than likely, events will be different this year in terms of capacity, in terms of what activities will be allowed, but a lot of that will depend on what direction things go with the pandemic.
And additionally to that, a lot of these events require a lot of financial investment prior to the actual event, both by the participants as well as by the hosts and the people that are actually putting them on. So if we are in a position to have some level of predictability about saving, obviously, people from the potential of being exposed, and or saving expense on the part of the hosts, we'll go ahead and do so. But it's always going to be with the understanding that it's a logical, practical, and right decision to make.
Jordan from the Exponent. Just wondering, since Monday is made available that anyone can get tested regardless of symptoms, is the health department going to be using that in some way to sort of move towards surveillance rather than just having people schedule appointments to be tested?
So the testing you're referring to is at the Indiana State Department of Health's testing site here in Lafayette. And they did change their testing criteria to basically open up the testing to anybody who wants to be tested, whether they have symptoms or not. So I think that's a step in the right direction in terms of our testing capabilities. That data, of course, goes directly to the State Department of Health. And as far as I'm aware, I don't believe they're collecting information on whether people are being tested with symptoms or without symptoms. That sort of data, though, is part of the Indiana University Fairbanks School of Public Health study, which is still ongoing. They've completed, I believe, their second phase, and hopefully results will be released soon. There'll be 2 more phases of that, and that study does involve testing randomly selected people from around the state, some with symptoms and some without symptoms, and trying to determine from a surveillance standpoint how many people are carrying COVID-19 but not having symptoms, what's our overall prevalence, and so on and so forth.
Question from Dave Banger. What advice are you giving Lafayette, TSC, and West Lafayette schools as they consider how to reopen for the 2021 school year?
So the school corporations did meet with the health department last week, and at that meeting we reviewed the Indiana Department of Education in-class guidelines and recommendations, and had a conversation about the general framework of recommendations, things that should be considered as each school system makes its plan. The school systems are in the process of developing their plans, and those plans will be worked on in collaboration with the health department, so that we can provide the safest environment for students and for staff at those schools. So the main recommendations are basically those that are contained within the Department of Education in-class recommendation document.
Is there any update on how much of a hit the county and both cities have taken as far as revenue goes, and have you seen revenue increase since the state started opening up?
Just to kick it off, we have not yet, because of the way our tax system works, it pays in advance. We just had conversations this morning with our city controller, with our president of our redevelopment commission, and one of our city councilors, and we are preparing for the potential of decreased revenues for next year. And then the year after that could even have a more significant impact. When you look at a city like West Lafayette and you look at its predominantly residential, there's a lot of things that influence that. When you look at the number of rental properties that we have and the taxation process that doesn't necessarily collect as much when people aren't in there, that could have an impact. So the good news is that we're aware of the potential of decrease in revenues, and we're currently putting circumstances and operations into place to assist us when that should happen.
And likewise, as John said, we feel that much of this will be felt in future years, but the one immediate impact for us has been in our highway funding. The money that comes in from fuel tax from the state filters back to the county is used to maintain our county roads, and one of the first issues that we had was we had to terminate a longstanding program called a dust lay program for rural gravel roadways, because there is an immediate shortfall that dates back to March, and we're starting to feel that crunch, in some cases as much as a 30% drop in revenue, and honestly that won't increase until folks begin traveling again and purchasing gasoline. So that's the immediate impact, and obviously about a month ago or so the county commissioners made a recommendation that in terms of employee raises for 2021 we settled on 0%, because we know like many Americans we're going to be dealing with some tough financial times as a result of what's happened.
Yeah, I think that's across the board too.
Yeah, when you look at a lot of city and county budgets are made up of income tax, COIT, edit, public safety lit, and those types of things. We know from people being unemployed that those revenues are going to be down, and even though the state recently has made an adjustment to allow 2 extra months of collections to go into next year, which would probably help a little bit, even though that'll make 2022 a little bit tougher, because there's only 12 months, in a year. So whether you put them, it makes a difference, but you don't gain months. So, we've looking at our COIT and our edit and those things. We know that we will lose very good chance of losing in the millions of dollars next year between those three line items. So we're being very careful so we can try to roll money over this year. We're keeping positions open. As Commissioner Brown said, our motor vehicle highway department gets hit immediately with the loss of gas tax money, so we're keeping positions open there. We haven't hired any summer help this year in that area to, again, try to save money, because that money is only about a month and a half in the rears, and so we got to make those changes right now. Looking forward with the COET and edit, that'll be for next year, so we're looking at how do we roll money over to ensure that we can cover that. We don't want to touch our rainy day fund if we can, and go without doing that. And some people might say, well, it feels like it's raining. Wouldn't you do that? But the truth is, we do know that 2021 and 2022 could be much worse if there would be some type of resurgence that would happen in the fall and the winter that would hurt the economy again. And so the reality is, this probably is not the worst year, and 2021 and 2022 could be worse. And so we need to be careful about how we manage those funds, looking at that 1, 2, and 3 year window as we make those financial plans.
Question from Dave Banger. Part of Purdue's plan includes a call to work with Greater Lafayette landlords to make sure living conditions are as clean as Purdue says residence halls will be. For Dr. Adler and Mayor Dennis, how do you see that working?
Well,
Go right ahead.
thanks, Doc. Generally speaking, when we talk about off-campus residential areas, we have an inspection team. It's called our Neighborhood Resource Team, and they do everything they can to make sure that the accommodations are suitable. Also working through our building commissioner. Those are kept in line as much as possible as well. But remember, this is a business for landlords. And the landlords have taken a significant hit this year because of people not going to Purdue. They are very concerned about their business, and I'm sure that they're going to be enthusiastic, encouraging people to lease their properties again. Insofar as what happens to the Purdue student body as a whole, any student that's coming back on campus is going to be acutely aware of the reality of this situation. And I know we often talk and sort of lightheartedly about how the students feel that they're invincible at that age. That might have been the case in the early days of COVID, but those days are over, and the awareness is high. The alertness of people as to what could potentially create a problem, not just within their dorm or in their rental property, but throughout the community, is that they're acutely aware of that as well. The biggest challenge that we have is trying to make sure that in the event that there is an exposure, in the event that somebody does test positive, how do we, as a collective, collaborative body working with Purdue and the administration at Purdue, track it, contain it, and do the social tracking to make sure that about exposure. With the density of the population that we have in West Lafayette, when you look at a city that's basically structured for 40,000 and we have over 80,000 people there at any given time, that is the biggest challenge that we have.
I'll also add that Mayor Dennis and I will be meeting with the landlord group. I believe it's in a week and a half or 2 weeks to discuss how to best make the off-campus living arrangements as safe as possible, especially with common areas, common spaces in those off-campus housing.
Question from Facebook Live. Has this group considered creative and innovative ways to have businesses require masking, such as the West Lafayette Menards?
Such as how they did it?
Yeah. In terms of innovative and creative, one of the, I'm not sure how innovative or creative this is, but the health department has encouraged businesses to strongly consider implementing policies like Menards has of requiring face coverings or masks for their employees and their staff. We think this is a very important tool, a very important aspect of preventing transmission of COVID-19, because in many of these stores and businesses, social distancing is difficult to maintain when you're in a crowded grocery store, a crowded pharmacy, a crowded hardware store. Maintaining that 6-foot distance is often difficult to do. So that's something that we're encouraging and recommending to all area businesses.
I've been in touch, obviously, with President Daniels, and I'm also trying, because of our schedules are a little conflicted, to get in touch with the Dean of Students. And the good thing about the students coming back at one time is that you have an opportunity to present sort of a mass presentation. Making masks a little unique and somewhat fun is always important. And we were looking at a slogan of "Boiler Up, Masks On." And hopefully that would be something that could be utilized on campus. You know, we always talk about individuality, and we always talk about the uniqueness of our campus population. And I think when you look at the masks and look at what the potential for the masks, I think that could be fun.
Thank you.
Question from Dave Banger. Following up on Jordan's question, will the county health department report clusters if they happen with Purdue athletes or anywhere else on campus, as it has with long-term care facilities?
You know, we certainly track clusters closely because that's part of contact tracing, and it's part of preventing further infections. The answer to that really depends on the size of the cluster and the extent to which it would affect people outside of that cluster. So it would have to be really done on a case-by-case basis.
I have a follow-up to the school's plans. It may be too early, but do they know if this is going to end up costing them any extra dollars to be able to implement some of these safety practices? And if it does, what's the, I guess, county and city's plans to help them with that funding?
I don't know the answer to that question about additional funds and expenses. Anybody up here?
I would hope if they do that there are COVID-19 funds available to reimburse, you know, local governments and schools, and I'm sure the schools will have some extra expense with the things they have to do. There's no way around that. So I would hope that they would be able to get those covered. I could tell you for like the city of Lafayette, there is a certain amount of money that we were allocated for COVID expense that we can get reimbursed through the state and stuff. We're not going to anywhere near have the expense of the money that's down there of what we've actually had to pay for. Our problem is going to be lost revenue, and you can't submit for lost revenue for those funds. So, you know, that's where our challenge is going to come. So the city, I can tell you, we will not be giving the school corporation additional money to help with those things, because our revenue losses may very well be even greater than theirs, depending on how they're primarily funded off sales tax and then some property tax funds. So depending on how that all works out, you know, we'll just have to see. But the problem for them, for us, is not really the COVID expenses themselves. There's pretty good reimbursement for that and way to do it. It's the lost revenue that comes with people not working, people not spending money, and those types of things. And if assessed valuations would happen to go down with property tax caps in Indiana, that could make the circuit breakers kick in, and we could actually lose some additional money to circuit breakers. So all of those things, you know, come into play, but all of those things are still up in the air at this point. Nobody knows exactly where those numbers are going to break at.
And then there's the other side, the side that we won't really know when it comes to some of the extracurricular events, you know, the athletic programs, some of the things that they do, some of the fundraisers that they have. Those are going to hurt them as well. The school corporations are thankfully in a position, at least in West Lafayette, they're thankfully in a position to where, depending on how long this protracts, they should be fiscally okay. And, you know, local government, because of what we're so codependent upon their own revenues, unfortunately are not in a very strong position to assist financially. But if there's other ways that we can assist, I'm sure that because the school corporations are so important to all forms of local government, we'll do what we can.
One of the things that we are also in a position to share is our experience. The schools closed in March, and, we closed at about that same time, and we've now opened. So we have a little experience in what it takes to open back up after you've been closed for a prolonged period of time. In terms of PPE, we can provide guidance and best practices on that, and we do have some funding, some COVID-19 funding, but obviously I think I would, the mayors would feel the same way. We want to be careful about how that is spent because we don't know if there's going to be additional funding in the future, and two, we have no way of predicting right now how long this event is going to last. And your needs just don't stop when school starts or when Purdue comes back. Those needs are stretched out or potentially over a long period of time.
Thank you.
Last question from Facebook Live. With the testing at Optum now open to anyone, if you're asymptomatic, why would you have a test? What is the point of an asymptomatic test?
Well, I think people will have different reasons for wanting to get tested. It may be because a family member or a close contact has been diagnosed with confirmed COVID-19. One thing to be aware of course, is that when you have the test done, it's just a snapshot in time. So you could be tested and the test could come back negative, but you could be exposed to somebody else with COVID-19 the following day and then still develop the illness. So I think for most people it'd probably be a matter of whether they were a close contact of a confirmed case. I believe that's all the questions for today, so thank you very much for attending, and see you next week.